This week afternoon talk is about lecture from Taiwan professor. We're told that we have a guest lecture, and then we will have a lecture with the knowledge on digital health. This is going to be awesome. Really sure it's going to be awesome. I will read.
Sorry, Pak Winnie, we can hear your sound clearly.
That's I have problem with my mic.
We couldn't hear your voice clearly, maybe because your headset, Mr. Winnie.
Really? Wait. Is it microphone, external microphone? Can you hear me?
Okay.
No? Can you hear me? Yeah. Okay, I should do it like this
Not
then.
clear, Pak Winnie, not clear. Very kresek, you know.
Very perfect. Okay, then I have problem with
You
it.
have
Okay.
to change your
Okay.
headset.
Okay, I will change.
Assalamualaikum, Bu Elsa, Bu Maria.
Waalaikumsalam.
Everybody can hear me?
Yeah, finally we can hear you, but still.
Then the cheap headset is not working for me.
Okay.
It's really good headset for the music, but it's not the mic. It's not good. So I apologize with that. Good afternoon, everybody. Welcome to the guest lecture from Magister Administrasi Rumah Sakit Universitas Muhammadiyah Yogyakarta. Today's guest lecture topic is about advanced transfer of knowledge in digital health. With our guest lecturer, Professor Wang Li Feng. Thank you for joining us this afternoon session. And before we start, our chair of department will have a speech. Miss Elsa, time is yours.
Okay, thank you, Mr. Winnie. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, the Honorable Professor Li Feng Wang, as a guest lecturer from Ministry of Health and Welfare Taiwan, and then all students from Master Hospital Administration Program Universitas Muhammadiyah Yogyakarta. Thank you very much, Professor Li Feng Wang, for your opportunity to teach our students this day. And then thank you for Dr. Maria Ulfa, has been organized and prepared for this event, and for our moderator, Mr. Winnie Setyonugroho. Okay, as we know, in pandemic COVID, I think digital health is a very important thing. And then digital health provide opportunity to accelerate progress in health and well-being to related sustainable development goals. I think it's all country make innovation transformation in digital health. So topic in right now is very, very good. As we know, the purpose of a global strategy of digital health is to promote health, life, and well-being for everyone, everywhere. I think it's very, very important. So I hope all students can take a new insight from Professor Li Feng Wang to apply this topic in a management hospital. Once again, thank you very much, Professor Lee Feng Wang. I hope you enjoy to lecturer in this day. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you. Terima kasih.
Ya, terima kasih banyak sama-sama Profesor Lee Feng Wang.
So, without any further speech, that we will go to main section now. And before we continue to the our guest lecture, I would read the CV, and I guess if I put all of the CV, it's not going to be enough to read it for one day, I guess. Professor Lee Feng Wang, background education is a computer science from University of Houston, Texas. His career starting in 1988 as a computer programmer, and then goes into the Director of Information Management Office, Medical Administration in 2001, and then 2006 till present is the Director of Information Management Office, Taipei Hospital, Ministry of Health and Welfare. I believe we shall start with this guest lecture, and time is yours, Professor.
Okay, thank you. 我点错了，开始。Okay, my name is Wang, Lee Feng Wang. I'm gonna have a lecture for everybody. How are you, everybody?
Fine, fine. We are good.
We are the Taipei Hospital. We are Ministry of Health and Welfare in Taiwan. And the title of today, I'm gonna say the implementation of the IT in the healthy service as an effect of hospital operation efficiency in Taiwan Hospital Information System in Taipei Hospital. About the Taipei Hospital, I have been working in this field. I working in a hospital for almost 30 years. So I'm an old IT man in hospital. The Taipei Hospital is a community hospital. We have around 500 beds. Currently, we have 110 physicians and on duty, and I have a total staff for member around 1,200 people. And we serve 40,000 outpatient per month, 1,000 inpatient per month. Our emergency capacity for a month is around 4,000. The IT investment around 1.5 million US dollar. This is a grand lookout for our Taipei Hospital for the IT. And the medical IT application, we have in Taiwan, every citizen have a healthy insurance card. It's an IC card, so you need to use this to go to hospital to get the medical care and the medical service. And the IoT application, we have a certain parts like security and the data storage and our message computation and the data analyze. We are the patient centralized and message connection for everything in using the IT technical. This is the instrument, digitalization. We can use our all the medical instrument by using the Bluetooth or Wi-Fi, Ethernet, IS-232. We can have all the patient information and the vital sign data, and we can analyze the data, can use in the ward or ICU or dialysis room or RCW room. So this is the outlook for the Taipei Hospital for some instrument digitalization. For example, now we have COVID-19, so we have to use video to meet each other, and everybody have to come to hospital to take the medical service. When they get into our hospital, we in the front door we have the COVID-19. We have a checkout and using the health insurance card. Then I can record your entry, and we can go to the health insurance. The location can see the TOCC, your travel history, occupation, your contact history, cluster, something like that. So we can right away know your healthy situation. And the community have a screening, a rapid screening, out-of-pocket PCR testing, our vaccine station, and our COVID-19 rapid screen result promote system. They are by using all the computer and the IT, IoT, all the technician. This is our community screening outside the hospital. So include everybody have to come to here to screening for the COVID-19. And this is a dome in the exercise department. And we have a vaccine station, can take the vaccine for everybody. This is our hospital, take the vaccine in the hospital. And by using the health insurance card. For you to come to hospital, then we have to make appointment. You can register. So you can register by using the computer, use your network, your website. You can have a registration before 3 months. You can make appointment with the doctor by using the computer. Our hospital serve more than 40,000 outpatients every month. By using the computer, they can manage all the patients. This is a service payment system. So you don't have to go to the counter to pay your medical fee. You can go to like a cashier machine. You just using the machine, you can pay by yourself. So you don't have to wait. This is efficiency for the IoT equipment. This is the emergency counter. This is our system. We don't have any medical record in paper. Everything, the medical record is in computer. Even your body scratching or marking is all in the computer. Every physician have 1 to 2 computers can do all these things. Okay, this is the standard equipment in our outpatient room. Doctor have 2 computer. The other one is your PET screen. And we have you can see all this. This is a number sign. You can make a when you come to see the doctor. Hold on. You have a number. When you register, the computer will give you a number. So when you come to see the physician, you go to this counter. Every room in front of every physician room, they have a checkout station. You just use your health insurance card to make a sign out. So you will know I'm here. So they will according your number to call you by using the computer. So they don't have to call, just wait for the number come out, and the sound will come out with the computer sound. So the nurse from the room, they don't have to go outside to call your number or call your name. So you just follow the instruction for the computer. This is sign-in number. So it's very easy for you to come to see the physician. This is an outpatient system. This is a PET system for the X-ray, MRI, CT, MRI. And when you take the picture, on the radiation department, when you come back to see the physician room, and the doctor will see the picture right away. So it's very easy for doctor can see your result right away. You don't have to wait few days later to see the result. And the physician can have a very quick response for your medical service. This is our radiology room. We have a CT, MRI, and we have a computers too. So they are easy to, you can make arrangement like the physician can make arrangement for you have a CT or MRI examination, maybe next month or next week, and you don't have to come to the radiology counter to make appointment. They can just make appointment in the computer. So you just can take the examination list and come back next week when the appointment time is come out. It's very easy for you to do that. And so the computer, when the physician have a medicine for you, and you can just go to the billing counter after you have a cashier, or you take a automatic cashier machine, pay the money, then you can come to the pharmacy and get the drug, your medicine. And this is our automatic packing system. And they pack the medicine by using the machine, not by people. Most of the medicine, like this machine, they can pack up to 400 medicine can pack by the machine. It's very easy for you. When after you pay the bill, and you come to the pharmacy department, most of the medicine is already ready for you. You can take out right away. So usually a patient come to hospital visiting the doctor. After visiting the doctor, take the exam, pay the bill, take the medicine around within 1 hour. Within 1 hour. So we have almost 2,000 outpatients per day. So by using the computer can do that. But if you don't use the computer, it's very hard for you to have this short time to manage all this procedure. This is our nursing station. our nursing station, all the nursing record by using the we call nursing information system. The record is all on the computer. This is our broadcasting board. It's in every, you can see over here. You can see all the schedule, the people, information, and who can have an emergency care. Something situation, emergency situation is here. Somebody have to care something. Somebody have to operation on the next morning and take the examine on this afternoon. It's all on this board. You don't have to write it down by using the paper. So we don't have our medical record in paper on the station. 下一个有没有车？没有。Oh, this is our nursing card. You can see we have a computer here, a screen here, and we have a barcode printer here. And this is a card for all the drugs is on the button on here. It's in here. Okay, so this is a mobile nursing card on the station, on the nursing station. So you can see all this. These are all in the station. So it's very unique. You don't see any paper. We have all the record on the computer. And finally, we have a hospital analyze system. On our hospital, we can completely replace the new generation hospital information on last year, on the July 1st. Last year, we just completely replaced a new IT system, our HIS system. So the new system is can get in the real time, and lots of operation information system can provide by the management department for decision making for reference use. The new generation system, we provide better performance, more efficiency, and more information provides for all the department to perform their better medical behavior. You can see we can run all this in every doctor's income. How many people we have right now, how many income we have right now. We can see on the computer right away, and the result will just within 5 seconds to 10 seconds. You can see all the our KPI right away. This is a brief for our HIS department, the system, and this is our international exchange. Lots of foreign country, like the visiting from the APEC, visiting from the Japanese institution, GS1, even from the Indonesia in your country, and South Africa, the Ministry of the Health will come to visit us. We have a lot of exchanges and a lot of experience to exchange. And this is a brief of today about the IoT or the computer in our hospital. Most of the hospital in Taiwan is similar like this, but either system is better or not. Usually the generation for the HIS is around 10 years to 15 years. You need to have a update generation. This is our new generation HIS system in our healthy department. Okay, this is a brief for today's lecture. If any question, you can ask. OK， OK OK， 那我现在讲完是，我讲多久？20。太久有人睡着。
Mr. Winnie, Pak Winnie.
Yes, yes.
Okay.
Is there any problem with that video sharing, or should we do from here? Prof. Wang?
Yes.
Yeah. Okay. So, do you have any problem with the sharing?
Sudah kuliah, sudah selesai Bapak. Discussion.
Okay. Sudah ya. Okay. Thank you. I was wondering myself. That's really good. For participant who wants to have a question, please raise your hand and then we will read, and or you can ask your question by yourself. Please raise your hand. If not, then I will ask many questions to Prof. Wang.
There is one question from Bapak Satyo, maybe Pak Winnie can read,
Okay,
or Pak Satyo.
Satya, please please turn on your mic, and would you ask yourself to Prof. Wang? Pak Satya, mau mengajukan sendiri? Yes, please.
Okay, thank you. Yes. I want to. I am from Satya from Indonesia. I want to ask about registration patient. If the patient want to treatment outpatient in Taiwan hospital, it is possible to register from home without going to the Beverly Hospital. Thank you, sir.
哪一个？
这是他的问题。
Registration patient, if the patient wants to treatment outpatient in Taiwan hospital, register from the home. Yes, you can register from home for the outpatient. You can register from home by using the website. Our website, you can make a register for 3 months before. So you can make an appointment for 3 months later. Every doctor. Is that solve your problem?
Bapak Satya, apakah bisa itu menjawab atau ada muncul pertanyaan lain?
Okay, thank you. I think enough, sure.
Can I ask something about it, Prof. Wang?
Yes.
Is it did you develop the registration system along with another system, or that come first when you develop the system, or when did you develop that system? The registration.
You get this system.
Yes.
This system is all included. The registration is the first step for the patient to make an appointment with the physician. So outpatient, you can do that, no problem. For the outpatient, we have 3 months before. Some of the hospital can make an appointment for 6 months. We are community hospital, so we have 3 months. Because if you make arrangement for too long time, most of the people, most of the patient, they will forget the time to come to hospital.
Okay. Is it that long queue because of is that because of the long queue of the amount of the patient, or is it because the time when the patient should come back to visit the doctor again?
We have such kind of most of the, if you are a long-term care patient, you get to come back maybe 3 months. 3 months
Oh, okay.
after you take the medicine, like myself, and I have a high blood pressure, so I take the medicine. One time I can take 3 months medicine. So after
Okay.
I finish my medicine, so I have to come back 3 months later. So doctor will give me a 3 months medical prescription. So I can take 3 months medicine for every month. I can take once. Okay.
Oh, okay.
So after 3 months, so he will make an appointment for me. 3 months later, you have to come back to take another 3 months prescription.
Okay, okay. That's so you can
Something
take-
like that. Now, and the other is like if the physician is very famous, so it's very hard for you to to make arrangement with him. So you have to usually, like, you make appointment when you take a very famous a ticket, something like that. So you
okay.
make appointment from the computer is more fair. So if you come earlier, so you can get a ticket. You can make appointment. Usually, we make appointment with. Suppose the physician have a 50 patient per morning, per one section. So usually they make a further appointment for almost half or 2/3 of the amount, like 25% can make an arrangement from the website.
Okay.
And you can use the telephone.
Oh, okay. Actually, I have so many questions more, but I will give the chance to the other participant to ask. The next question is from Miss Mastuti. Would you turn on the mic and ask your question by yourself, please?
Yeah, thank you, Mr. Winnie. I want to ask you, Prof. It is very amazing for me, but need big cost to start it to provide infrastructure. Can I ask you the budget for the infrastructure from the government or from each hospital itself? Thank you.
Mostly is from ourselves, in our hospital, because we have income. So we have a certain amount of the budget is from our income. So most of it is from our hospital income.
How many percent investment?
3% to 5%.
How many?
3% to 5%.
Oh.
Below 5% for the total income.
Okay.
So around, let me see. Around for the IT, you mean for the IT budget or the total budget?
IT budget.
IT budget 5% is around 10,000. 100,000, 100,000, 100,000, 100,000 US dollar
Oh, okay. Each year. Okay, that's
per
interesting.
year, per year,
Per year, per year.
per
Okay.
year. Yes.
Miss Master T, do you want to ask another question? Okay, I will continue to the next question from Mr. Heri Suroto. Mr. Heri Suroto, please turn on your mic and then ask the question to Prof. Wan.
Thank you, Mr. Winnie. I would like to ask about your system. Is it totally paperless?
Yes, paperless. Mostly paperless.
Okay. So regarding the content of the medical record,
Yes.
it's possible to make additional data if you want to collect the data for the research. What do you
Yes,
think?
yes, yes, yes.
So
Sure.
the flexibility is still possible to add the data.
Yes, yes.
Okay. According to the screen that I have seen, in the table of the medical doctor, there are 3 computers. Is it disturbing the communication between patient and the doctor? What do you think with that condition?
With what condition?
Yes, I mean in the table of the medical doctor, there are 3 screens.
Yes, yes, yes. 3 screen.
Yes. What about the communication between patient and the doctor? Is it disturbing with that condition or still okay? What do you think?
It's very hard to say. Usually, depends on the doctor. You have point out a very good question. Usually, doctor will look up the patient maybe only 10 seconds when you're asking something. The other time, he will look out the computer screen. Yes, you're right. But this is our situation in Taiwan. But usually, our patient is already get used to it.
Because personally, when I make a communication with the patient and simultaneously I fill in the computer,
Yes.
it is quite difficult for me. So usually I
Yes.
need an assistant
Right.
to
You're
fill up the
right.
data in the computer. Yeah.
But usually it depends on the doctor. Depends on the doctor. Usually, if the patient is get used to it, so he will ignore about this situation. But usually, physician will listen. But maybe the eyesight will not point to not face to the patient. You're right. You're right.
Okay. The last
But this is
question.
the situation for now.
The last question.
It's a good question. It's a good question.
Yeah. Because I have that challenge, that problem when I talk to the patient and family, especially in the patient that needs surgery. We must intense communication. What's the
Yes,
problem?
yes.
What's the planning?
You have to face to them. Yes.
Yeah.
Yes. More friendly.
Yes. The last
Right.
question. Yes. Can we open the data from the house? For instance, in emergency, I doctor in charge in that day, so I can monitor what the X-ray, what the clinical condition with that data. What do you think?
You mean from the like us?
Yes.
Right now.
Yeah.
For COVID-19, okay. For now, in COVID-19 time, we can use the video to see the patient.
Okay.
According to our medical law in Taiwan, we cannot use the video to see patient.
Okay.
It's not allowed.
Okay.
Okay, but
Thank you very much.
in some situation, maybe the patient is in the urban, outside, very far from in the mountain or the other island. It's very hard for them to see the doctor. Some of the area can do that.
Sorry, Mr. Winnie, one more question.
Yes, please.
And the patient after inpatient, so the patient after outpatient now,
Mhm.
what about the connection between patient and the hospital? I mean, is there any officer from the hospital to make a connection to the patient and family after as an outpatient?
After he out of the hospital,
Yes, yes,
after the inpatient,
yes.
usually we have we call personal management. We can see is a nurse. Okay, after he go from the hospital and go home, and we have a after service. We will follow the maybe the situation for him. He will make a maybe opinion or after service, something like that. We have some kind of service. Yes.
Thank you.
So the doctor will make appointment maybe after he go out from the hospital, maybe 1 month or 1 week, he had to come back to the outpatient to see the doctor.
Okay, thank you very much.
You're welcome. Thank you.
From other participants, is there any other question? You could write your question in Bahasa if you want to, and then I will try to translate it to Prof. Wang, or you can ask directly to Prof. Wang.
Our computer system now mostly is according to the law is almost according to the health insurance. So the regulation from the health insurance company will give us the regulation. So most of the design for the system is according to the health insurance. So
okay.
most of the hospital, the computer system in most of the hospital, the foundation is almost the same because the regulation is the same.
Basically, the system will follow the
government. Yes, the insurance. Yes.
Actually, I have a question myself to you, Prof. Wang. You are coming from different hospital before this current hospital.
Yes.
And you have 30 years of experiments as an IT guy in hospital.
Yes.
My question is actually almost the same with Ms. Mastuti. When you develop the system, or you develop the system from beginning, or adding up a system, what is the main concern from you to develop the system? What is the first decision? Which one should start first? Or what should I consider first?
I just discussed with my colleague today for Indonesia, suppose. Okay. For the computer system to pick up, most of the easy way, just like registration first. Okay, you have to have a medical record. The second, okay, you have a physician system.
CPOA, physician system. Okay.
Yes. Okay. SOAP. Okay. You have to have a pharmacy, radiation. You are all the examination center system. You are PES system. You are billing system. Okay.
You consider billing as quite low, what you call,
Not the first
yeah, not the first
priority.
two. Yeah.
Okay. The other way, registration, physician, medical, billing. This is the fundamental. If you have an insurance,
Yeah.
you have insurance, okay, fine. Registration, medical record, physician system, billing system, and the insurance system. Fundamental, the baseline. At least for the first generation, you need at least this 5. And you will increase your efficiency at least 50%. 50%. If you build up this system in maybe 1 year, you can see the difference. The efficiency will increase around 50%. So the people come to hospital, maybe take you 3 hours. Okay. If you have this system, like just I say, the best one, maybe within 1.5 or 2 hours, you can finish all the procedure. So the best one, you need to have this. Don't use too much. The mostly we develop the system, we will find out what is the manpower costing. If the manpower use the lot of manpower of that kind of procedure, do that. Design the system that first.
Yeah.
Okay, like you have to write a lot. Okay, you have to wait for a long time.
Yes.
Okay, do that first.
So in developing the system itself, do you consider in-house software developing or
outsourcing?
Outsourcing.
Good question. If you don't have experience, like our hospital, we have 1,200 people employee. We have around 40,000 patients per month. Okay, we are community hospital. Okay, we are a district hospital. We are the second level. The first level is medical center. Now we are the second one. So it's a big hospital. Okay, you need to have all this system. Otherwise, you cannot afford. Lots of people. We have 2,000 patients, outpatient per day. But our lobby, you don't see any people waiting on the line by using the computer. So you have to do that. But if you outsourcing, it's easy for you to get right away. Usually, we get the outsourcing first.
Okay.
Get an outsourcing company, a computer system first. Then you have your own people. Okay, the IT department in your hospital, you can learn from them. Okay. We are the situation right now. Our computer system is outsourcing.
I see.
It's outsourcing. Yes.
Is it okay with the compatibility with the?
Usually, if you want to develop by yourself, usually they get the outsourcing system first. Then they hire people to learn that. Usually, if you got a maintenance for your IT department on yourself, at least 15 to 20%.
How many IT?
15 to 20 programmer at least.
Okay.
Then you can manage that. But they have to learn around 2 to 3 years. Then can get used to it. Usually.
15 to 20. That's a lot.
Yes. It's a lot of people. So you can adjust. If you hire 15 programmer, maybe cost you $1 million. but you can have a outsourcing company only 80,000 per month, maybe. Oh, okay, something like that. So you
Okay.
can. That's a cost benefit. Yes.
So, but you still consider that after we purchase, we should maintenance and develop by ourselves, right?
Yes, but not hire so many people at the first time.
Okay. Okay.
Step by step.
Step by step.
Yes.
This is important information because
Yes.
so many.
Step by step will be easier. For like example, if I give you a system from Taiwan,
Okay.
our system for you, but you don't have manpower to develop it or to maintain it because the language first,
Yes.
right? And the algorithm in the computer language, okay? But most of our languages is using the English, so it's easy for you to recognize.
Okay.
Okay, but the picture of the user, they need to use Indonesia, right?
Yeah. Yeah.
I cannot give you English or Chinese, right? So you have to translate that first.
Okay.
So the good way is I give you a resource for our computer system, but you have a company in Indonesia, local company can take over that and the maintenance. Maybe we can have some manpower to train you. Okay, then your local company will grow up. Then you can take over by yourself. That's the easy way to do that.
Okay, so starting at okay,
Yes.
okay.
Don't start from the beginning. You can get a right away system first, then learn the instrument inside. So it'll be easy for you to take over. That's the best way to do that.
For the beginning, how many million should we or thousand USD should we expect to develop at the first time or buy?
You
or
mean
implement
the system, the budget of the system?
Yes, for the beginning of the implementation.
If our relation between our two countries is very good, maybe it's free.
Oh, okay.
It's not. I think it's not the money issue.
Okay, okay.
It's the technician, the manpower experience, the experience of the system design inside.
Okay, okay. Thank you. Thank you so much.
That's very important for every system to build up.
Okay. Interesting information.
Yes.
Thank you so much. And is there any other question from other participants? Please turn on your mic and you can ask by yourself. I believe your system is so advanced and then we just drop our jaws. It's like, oh my goodness, it's so good. And then
we just rebuild. We just replace a new one.
Okay.
For me, I just take me 3 months to do that.
Wow.
A new system, 3 months. Is I break the record for our country. Nobody can do that.
How many IT guys behind your team?
Pardon?
How many IT
our department?
Yeah, in the department.
8 only. 8 person only, including me.
Oh wow.
Yes. So it's a miracle, right?
Only 8. Okay.
Only 8. Take us only 3 months to do that.
Are all of them are programmer or some of them are general IT or home? all of them are programmer, or is there any requirement for other in your department?
We have 3 programmer only. The other 5 is doing the other thing.
Okay.
So you can learn by like our department.
Okay.
5 to 8 person, you can do that. Then get a system for outsourcing.
Ah.
Really? Yes, you can get some system from our government. Maybe it's free.
Ah. Okay.
We have some manpower can teach you how to do that. Really, it's for me. It's not so hard. I on this month on the 1st of October, we just built out another hospital. Our same level hospital.
Ah, I see.
Half a year, we just change another system for another hospital. So for me, it's not so hard to do that. If you don't have a computer system, that is more easier to do that.
Okay.
Mm-hmm.
Oh, okay. So doing from the fresh one is easier for you compared to okay.
More easier. If you don't have a system, so I give you a new system, you will according all the regulation. So I don't need to change it a lot. You just follow the book.
Ah,
right?
okay.
Yes, because you don't have this kind of experience. So I give you anything, you will take everything.
Ah, right? Okay.
So it's very easy for you to take over. Really, it's not so hard.
Okay. Yeah. Finding like you is the hardest part for us. That's the hardest part. Okay, thank you so much.
Because I went to Indonesia couple times. So I know the situation in your country. I went to Yogyakarta, Banda Aceh. So I'm visiting a lot of hospital in your country. Yes.
You should visit again here in Jogja.
Yes. Because of COVID-19, I cannot go.
I know. I would love to go there again. From the participant, is there any other question? Is there any other question? Maybe you want to develop a system, then you need to ask a question here. There is no more question, and I believe we could close this. Yeah, and before we close, I will summarize from your speech. It's so simple to build the hospital information system. Only the problem is only you want it or not. It seems that if you want it, it will happen.
Yes.
Yeah, if you want it, then it will happen. So for the participant, if you want to create or develop hospital information system, then the management, what you call a decision, is play important role here. If they want it, then we can do it. Thank you, Professor. This is really good insight.
Thank you, everybody.
For us. And before we close, we will have a photo session. This is a digital era, so we have to have a photo session.
Oh, okay.
Even though we are far away.
就坐着就好了。哦 ，OK， 拍照嘛，是吧？
Yeah, please everybody turn on the video, and then we will have a picture. Give your warmest smile to everybody. Let's count. 1, 2, 3. Okay, and then I believe another screen. Mas Edwin, berapa screen lagi?
2 more.
2 more. Okay. I will count 2 more time. Okay. 1, 2, 3. Smile. And then another one. So one more screen. 1, 2, 3, smile. Okay, thank you so much.
Thank you. Thank you,
Hope-
everybody.
yeah,
Thank you.
hopefully I can visit you
Yes, yes.
someday.
I hope we
after
can
the
see
topic.
you very soon.
Yeah, hopefully.
Thank you.
Thank you so much. Thank you everybody for coming to this lecture, and then we hope that all of you diberi kesehatan. I don't know in English. Thank you so much. Good afternoon and Assalamualaikum warahmatullahi wabarakatuh.
Thank you. Terima kasih.
Thank you so much.
Thank you.